Good evening and welcome back. As per my previous video, I said in that video that during the next session we will discuss about isolation. So let us start. What is isolation? Isolation is required for those patients who is having a contagious disease. For isolation, we need different kind of rooms. Like in some diseases we need negative pressure, other diseases we need positive pressure. In some diseases we need isolation but without negative or positive pressure. Here we have nowadays a disease, coronavirus, which don't need any kind of negative or positive pressure room. It just need isolation with very good ventilation and attached bath. But in very worst situation, like nowadays so many countries have number of patients and they don't have space in hospitals. So in this situation we can cohort the patient with same disease, like coronavirus, two positive patients we can keep in the same room, but we should make sure before shifting or before cohorting that the patient is having a confirmed positive, not suspected, or any other respiratory problem patient or any other respiratory infectious patient. We cannot cohort with COVID-19 patients. So when we are cohorting, we should make sure the same disease should have for both patients. In coronavirus positive patient, we need a very good ventilated room unless we don't have aerosol generation procedure. If patient is having a aerosol generation procedure, then we need room with negative pressure. Make sure when you have an isolation patient, there should be an attached bath. The confirmed COVID-19 patient, when the shift start, the workers who start in this unit where there is COVID-19 confirmed patient, this worker whole shift they should work only with this specific patients. They are not allowed to go to other patients and shift this infection to the other. They should work whole day with the same patient with the same kind of disease. Now we will discuss about PPEs, because this issue is really a very serious issue nowadays. The number of PPEs is decreasing. There is no enough PPEs in the market due to this outbreak. So what we should do, when the staff started shift in one unit, they should wear whole PPE. But when they are shifting between patient to patient in this specific unit, they should not change whole PPEs. They should change only the gloves and gown if required. Gloves they should must change between the patient and gown when it's required. But they should not change face shield and face mask. Why? Because when they will change during this situation or when they are present in the unit, they may touch their eyes, they may touch their nose, so they will transfer the infection. They should not change face shield and face mask, but they should change gloves between the patient and gown if needed, and they should do hand hygiene between the patients. It is highly recommended that don't touch your face shield or face mask when you are on duty or when you are working with patient. This is all about isolation of COVID-19 patients. If they are symptomatic, we should start the treatment as per doctor recommendation. If they are asymptomatic, we should take care only. Now we will discuss about history of isolation, when it is started. Actually, CDC started this project for isolation in 1970, and they introduced 7 types of isolation at that time. It was strict isolation, respiratory isolation, protective isolation, enteric isolation, wound and skin isolation, discharge isolation, and last was blood isolation. But in 1975, they established the second edition of isolation techniques for hospitals. But the concept was almost same like first edition. In 1983, CDC prepared the full guidelines for hospital isolation. In these guidelines, they mentioned 2 systems. Here I will clarify. In 1970, they introduced 7 type of isolation, but in 1983, they introduced 2 systems of isolation, which was category specific and disease specific. And they changed the blood precautions into body fluid precautions. In these guidelines, category specific include strict contact, respiratory contact, AFB, acid fast bacillus, enteric, and secretional blood and body fluid isolation. In 1985 to 1988, during this period, epidemic happened for HIV and AIDS. So CDC introduced the standard universal precautions regardless of patient is positive or not positive. In 1987, CDC started body substance isolation. They emphasized to avoid contact with all moist and potentially infectious body substance except sweat, even if the blood is not present. In 1996, they reached on final point which we are using nowadays, that was universal precautions for hospital. They combine major feature of universal precautions and body substance isolation, and they make one standard precautions by mixing of these two. Same time, they introduced 3 transmission based precautions, which was airborne, droplet, and contact. Inshallah, in next video we will discuss all about these 3 concepts of transmission based precautions, which is airborne, droplet, and contact precautions. Hope so my video will be interesting for you. If you really like it, share with your friends and keep it sharing, so maybe some of our colleague will get benefit from this one. And please, if you are on my channel, subscribe it and like it. Thank you so much.